Hi, I'm MaryAnn Klassen. I'm from Canada, and I'm very thankful to be here and appreciative that I have an opportunity to meet with you. So I'm going to introduce you today to Meivertor, but before I get started, could I ask everybody in the room who is an optometrist, ophthalmologist, or a staff member in a practice, put your hands up. Okay, keep your hands up, and keep them up if you are currently doing meibography in your practice as part of your diagnostic workup. Okay, and keep your hand up if you are routinely imaging both upper and lower meibomian glands. Okay, we lost a few there. I'm not surprised to hear that. I've been in this industry for well over 30 years in marketing, and when I talk to practitioners and I ask them that question, are you imaging upper and lower glands, the vast majority say no. And when I ask them why, they say, well, it's really a bit too finicky, takes time, it's hard to handle the meibographer at the same time. Or they say, you know, my technician does most of my imaging and my technician is really uncomfortable averting the lids. So I just use the lower lid as a proxy. So on that, I'd like to introduce you to the Meivertor.
Introducing the Meivertor. The Meivertor tool offers a single-handed solution for averting a patient's eyelids for the purpose of imaging the upper and lower meibomian glands. The tool is aimed to address the difficulties, discomforts, and hygiene concerns of the alternative two-handed method. A new sanitized set of silicone tips are used for each patient, avoiding the risk of cross-contamination between patients and between patients and staff. Each tip includes a cavity to install on the stainless steel handle, key to ensure they are installed in the correct orientation. Aversion of the upper eyelid is accomplished by first gripping the eyelashes between the silicone tips. The eyelid is then gently pulled away from the eye while the tool is rotated. The tab on the upper tip is pressed into the upper eyelid, and the continued rotation results in complete aversion of the lid, fully exposing the meibomian glands for imaging. When the tool is closed around the eyelashes, the tongue and groove feature in the tips ensures a secure and even grip across the eyelashes, reducing discomfort and improving the ease of rotation. The stainless steel handle includes semi-cylindrical grips with etched surfaces to allow for part of the tool rotation to be accomplished by rolling the tool between the index finger and thumb, reducing the amount of rotation required in the wrist and arm of the user. To avert the lower lids, simply press the bottom of the Meivertor tip parallel to the lower lid margin. Pull the lid gently down. Then, with a slight outward rotation while pushing up, will reveal the lower meibomian glands for imaging. The unique design of the Meivertor requires just one hand to avert the lids, both upper and lower, while the second hand operates the meibographer. The Meivertor is easily used by both the eye care professional or by their staff to successfully expose and image the patient's meibomian glands and manage disease progression over time. The Meivertor has been personally assessed by renowned doctor of optometry, Dr. Paul Karpecki, his colleagues, and technicians. Dr. Karpecki stated, with regard to imaging upper and lower eyelids, I believe all doctors would prefer to see both. However, the majority of practices only image the lower eyelid. I believe this is because we don't have a good tool to image the upper eyelid and essentially would need 3 hands. It seems obvious to me that an instrument like this is a better option than the alternatives, especially for the ease of capturing the eyelids, efficiency, overall professional look, and patient responses. The Meivertor, the tool for every eye care professional.
So just to take that one step further, so why? Do we really have to bother to do this? I mean, the lower glands show us a lot. But what about patient flow, experience, engagement, and patient retention? We know that patient flow is all about efficiency. So why not on intake, whether it's for baseline assessment, for screening of meibomian gland dysfunction or dry eye, or even disease progression, why not utilize it at intake, have your technician take all 4 images, and when the patient sees you, you're already set with all the images. Second is patient experience. Would you rather have your patients experience this, or would you rather have them experience this? Next is patient engagement. We know that with any chronic progressive disease, whether it be diabetes or hypertension, psoriasis, eczema, any of those things, or dry eye, that we know that we need to involve the patients in their own care. And active patient engagement is really key to patient compliance. And so a picture is worth 1,000 words, so why not provide the images to help the patient understand their own disease and improve patient compliance. So when you take together patient flow, efficient patient flow, positive patient experience, active patient engagement, it all leads to patient retention. And we know that when we have good patient retention, we also optimize our investment. So the Meivertor has been used with all of the meibographers that are available on the market. It simplifies the process of using them. And I think it makes it easier to tell the patients that if you're asking them to continue to invest in IPL, LipiFlow, RF, that if we show them the reason that we're actually managing the progression of the disease over time with all the lids, with all the glands, that we'll have a better chance of retaining those patients. So I thank you for your time. Meivertor, a simple solution.